Now, the Mayor of Sheffield City Region, also a Labour MP, Dan Jarvis. Good morning to you.
Good morning.
Good morning. It is extraordinary that these stories about what happens in terms of local lockdowns, particularly affecting northwest and northeast of this country and some of the Midlands as well, it's all been sort of leaked out via the papers rather than a formal briefing. Talk of shielding returning in infection hotspots, as we were just mentioning, measures lasting as long as 6 months, and yet very little conversation actually taking place with the elected representatives for these areas. How much contact have you had as the Mayor of Sheffield City Region and as an MP for the area? How much contact have you had and information from the government so far?
Well, I have had some contact, but I haven't had the meaningful engagement that I would expect. The government has trailed in the newspapers very significant measures that they're likely to be looking to introduce in the near future. And what they need to be doing is talking to leaders in the north, metro mayors and leaders of city councils, so that we can be informing the decisions that they're making in Whitehall. In the end, whatever they decide will have to be implemented at a local level. It'll be in town halls around the country that the actual work is done to make this happen. So the government needs to get much better at involving local council leaders and metro mayors earlier in the process, so the decisions that they're making are actually informed by the reality of what's happening on the ground.
And this is the issue, isn't it? Local leaders, I mean, this has happened across the board, whether it's Liverpool, Manchester, Newcastle, everywhere. They've been saying, we would like to be in charge of the test and tracing going on in our local area. We want to be in charge of what local measures, whether it's getting local powers to, say, close down the pubs that are infringing those the rules of social distancing and hygiene and the like, but allowing other businesses to stay open, using local knowledge, as you say. When you suggest this to the government, what is the reason that they give for that not happening?
Well, you'd have to ask them precisely why they're doing what they're doing. But it seems to me that we've got a very top-down, overly centralised approach. That is not the case in other countries where, frankly, they've been more effective at fighting the virus. It seems to me that what you need now is joined-up government. You need everybody coming together, local, regional, national government, pulling in the same direction. And that requires ministers, senior officials in Whitehall to be reaching out right around the country to properly understand the challenges that local authorities are facing, and they are huge, and actually work constructively with mayors and local council leaders to address those particular challenges. It seems to me, that for whatever reason, the government don't want to kind of embrace a devolution arrangement that they themselves have created in recent years. Mayors, council leaders are part of the solution to this challenge that we face as a country, but they need to do much more to involve us in the process, because that isn't happening in the way that it needs to, and it's not acceptable that we're finding out about these things in the papers.
And how welcome would be the announcement we are expecting from the Treasury today from the Chancellor Rishi Sunak, a new furlough scheme for areas that do go into local lockdown, paying workers, I mean, we understand it be specifically the sectors where they're being closed down, 2/3 of their wages. Is that going to actually touch the sides of the economic problems that local lockdowns do have? Because we know that even when businesses are able to stay open, they don't get the footfall if people aren't out and about. And a lot of the businesses, well, OK, the wages are covered, but a lot of the other costs of them staying open without any customers aren't covered.
Well, in general terms, I think we'll obviously welcome what the Chancellor says, but we'll need to look at the detail of it. What I've been saying and what other leaders across the north of England are saying is that it's absolutely critical that any new restrictions that the government want to impose come hand in hand in terms of support for the economy. We all know there are certain sectors that have been incredibly badly affected over the past few months and are likely, in many cases, to go under without support from national government. So I'm expecting some kind of announcement from the Chancellor later on today. We'll have to look very carefully at the detail of what it will be. But I think that some kind of local lifeline to ensure that those businesses are under huge pressure is an absolutely essential component of any new restrictions that are announced by the government.
And can I ask finally, in terms of the virus rate in your part of the world, we are seeing a massive north-south divide on this, and a lot of people think, well, this is down to either sort of smaller housing, more cramped conditions, more multiple occupancy homes. People talk about poverty, other issues in many of the northern cities, but also the effect of the fact that an awful lot of the south, particularly London, was very hard hit by the virus early on in March and April, and therefore there may well be some level of herd immunity, which means that we are not seeing the same sort of rates of the virus increasing right now. How concerned are you about the rate of increase? Is a lot of it down to, say, young students in the area who therefore are not a high risk, and as long as you can keep them on campus, frankly, they're not going to be a risk to the wider community? Or are you concerned that this is a big issue? Because there seem to be two very different schools of thought on this.
Well, look, I'm certainly very concerned about the rapidly increasing rate of cases in my area, but more broadly across the north. I remember back in March saying that my real fear in all of this is that the NHS will be placed under massive pressures over the winter months. Now, winter has not yet started to bite, so I think it's incredibly important, and I raised this with Matt Hancock in Parliament the other day, incredibly important that the government makes sure that the NHS has got all the resources it needs to get us through what is going to be the most challenging winter in its history. I don't think that we should forget about the fact that the government were elected on a commitment to level up the country and a commitment to the Northern Powerhouse as well. And I think there's a real risk that COVID will level down the country. And that's why the government need to be involving local leaders like Judith, like myself, Andy Burnham, Steve Rodden, and all of these people across the north, because we do want to work constructively with the government, but we need that engagement, we need that investment so that we can make sure that the decisions that are taken reflect the reality of the challenges on the ground.
Dan Jarvis, Mayor of Sheffield City Region and Labour MP, thank you very much indeed for joining us. Let's go from Sheffield then, just a few miles up the M1 to Leeds. The councillor Judith Blake is the leader of Leeds City Council and joins us now. Good morning to you.
Good morning, Julia.
We've just been talking to Dan Jarvis in Sheffield, and obviously big concerns about this top-down, over-centralised approach. Do you share his concerns, and how much information have you been given as a leader of the council there by the central government about what's going to happen?
I completely share Dan's concerns, and along with leaders right across the north, and we've just been appalled by the way the information leaked out through the briefings to the press. Was it yesterday morning? So we've been asking for clarity. We understand that they're firming up the requirements to tell us which of the tiers they want us to go into. We are going to have briefings today. So we'll hopefully find out more by this evening, but at this moment in time, we don't know exactly what will be expected of us and when it will come in.
And this is it. This isn't just people wanting to know. This is hugely practical. Whether people are going to open their businesses next week. I mean, if you're a pub or a bar or a restaurant or a cafe, whether you know that do you need to put your orders in for your food or not? Cancel those orders. Whether suppliers need to turn up, whether staff need to turn up. Incredible amount of information that people need to get on with their lives and get on with their businesses. Is it your hope that, I mean, do you want there to be a local lockdown, or would you rather try and keep things going and just tackle individual outbreaks as they happen in the local area using individual knowledge and powers?
What we've said all the way through is we want to do what works, and at the moment we are not supplied with the evidence as to why government is thinking that this lockdown across huge areas of the north will actually have the desired impact. Many of my neighbouring authorities have had restrictions in place for weeks now and are still seeing their numbers rising. So we understand that MPs yesterday were provided with some data, but we're not clear of where that data came from, whether it's accurate, and whether it actually supports their case. We know businesses in Leeds and beyond have gone to huge lengths to make their premises COVID secure, really are monitoring people coming in, getting their data, and helping to manage them leaving the premises afterwards. And our concern is if this isn't done properly, it will just force the problem underground. People will stay at home, and we know that household infections are actually a greater risk from our point of view.
Well, indeed, again, the test and trace data says that about 5% the times when people are getting infected, it comes from being at a pub or a restaurant. And yet the data that was given in that scientific briefing by Chris Whitty and Edward Argyle, the health minister, yesterday said 30% of exposures are in pubs and restaurants. But again, this data is based on the idea that people who are testing positive, they're giving information about where they've been. And often what they're saying is, I've been out to eat or I've been out for a drink. But almost by definition, people who are out at work, who have got kids at school or whatever, or people who are going out and about and are likely to get the virus from someone, may well have gone for a drink or a meal. But just because you've got that correlation, it doesn't mean that was where they caught the virus. This is the thing, as you say, we may well be closing all these wonderful, viable businesses who've done so much to try and keep themselves afloat and keep people in employment. And you say people are going to be drinking at home, mixing at home, no social distancing, no hygiene. And actually, we're going to see an increased spread of the virus rather than any lesser spread.
No, absolutely. And if that data was showing us that they had actually picked up the virus in a particular venue, that would be a whole different thing. And that would be possible to do if we had a proper contact tracing mechanism in place. So what we're very keen to do is to repeat everything we've been saying all the way through, that we need more local control. We need more powers to close venues down if they're not complying. We need to continue what we're doing, trying to get a clear, consistent public health message out so everyone knows exactly what they're doing and why they're doing it and what the impact of their taking very difficult decisions in their lives, but knowing that it's actually making a difference and will help us to get through this more quickly.
Indeed. Thank you very much indeed for joining us, Judith Blake, Councillor Judith Blake. She's leader of Leeds City Council.